Inpatient falls prevention training at Eastern North Hertz NHS Trust. Fall is an event which results in a person coming to rest inadvertently on the ground or floor or other lower level. There were about 220,000 emergency hospital admissions related to falls among patients aged 65 and over. The total annual cost of fragility fractures to the UK is about £4.4 billion. Fall is the most commonly reported patient safety incident in England and Wales, with about 240,000 reported incidents in acute hospitals and mental health trusts. It can cause harm and distress to patients and put pressures on NHS services. Falls can result in severe harm to patients, and in some cases, patients have died due to injuries sustained. The estimated cost for hip fractures are about £2 billion. Falls can result in increased length of stay, and there is also increased rates of discharge to institutional care. The costs for falls associated to social care use are about £1.1 billion. Many falls do not cause injuries, but 1 out of 5 falls cause physical and psychological harm. Some of the physical effects of falls are head injuries, fracture, dislocation, laceration, sprain and strains, or even death. Some of the psychological effects of fall are fear of further fall, withdrawal, loss of control, emotional distress, increased dependency, anxiety, and depression. This can also cause stress to carers. This slide shows the Trust's inpatient falls data. The graph on the left are the total number of inpatient falls between 2018 and 2021. You can see the downward trend on the total number of inpatient falls on this graph. The graph on the right shows the total number of falls with harm between 2018 and 2020. You can also see the downward trend on this data. Nationally, we are reporting falls per 1,000 bed days. The average falls per 1,000 bed days nationally is 6.6. The graph on this slide shows the rate of falls per 1,000 bed days between 2019 and 2021. The average for falls on this data is 4.3, which is currently below the national average. Risk factors for falls are history of falls, poor vision, medications which may alter patients' consciousness and balance, like blood pressure medications, antipsychotics, and benzodiazepines, among others, weakness and walking problems, certain long-term medical conditions like stroke and Parkinson's disease, inappropriate footwear, and environmental hazards like bed cables and spillage on the floor. At Eastern North Hertz, we have put some mitigating actions to prevent patients from falling and reduce the effects of falling. This includes falls care plan, low-rise bed, appropriate use of bed rails, bay watching, and utilizing enhanced care team support to safely manage patients who are high risk of falls. We are also reporting all falls incidents in order for us to capture the learnings. Despite of the mitigating actions we have in place, patients can still fall. The questions we need to ask ourselves is, was that fall preventable? What are the learnings we have captured from the fall incident? What are we going to do next? Falls risk identification assessment is a falls care plan that we need to complete within 2 hours of patient admission or transfer. Your response on the first 7 questions will determine the falls risk of the patient and what actions to take. You need to ensure that you follow the actions identified on the care plan based on the risk of the patient. The next part of this care plan is the risk assessment for the use of bed rails. If you are considering the use of bed rails or low-rise bed to your patient who cannot consent and appears lacking capacity, please ensure you complete Mental Capacity Act assessment. Best interest decision needs to be done if patient lacking capacity, and deprivation of liberty safeguards needs to be done if patient is on continuous supervision and control. Risk of falling falls prevention plan needs to be completed for all adult inpatients within 2 hours of admission or transfer. The first part of the care plan are the falls strategies for all inpatients. The second part are the actions you need to take upon completion of falls assessment. This includes referral to physiotherapy if appropriate, bedside vision assessment if patient is over 65, continence assessment and care plan, and lying and standing blood pressure if patient is over 65. Bedside vision check and lying and standing blood pressure forms are available in the falls prevention page of the Knowledge Center. Please ensure that lying and standing blood pressure are recorded in the nerve center. The third part are the actions that needs to be reviewed and update daily. Baywatch is a term used to describe a cohorted bay of patients at risk that needs continuous visual contact. Staff must have view of patients on Baywatch at all times. A tag system should be in use to ensure consistent cover. Baywatch poster should be put on the identified Baywatch bay. The Baywatcher's name should also be written down on the poster so the staff on the ward can visually identify the Baywatcher in the bay. If you are the identified Baywatcher, you must not leave the bay unless you tag another member of the team to replace you. You must also hand over the lanyard signed out on the login sheet and replace the Baywatcher's name with the tag member. The tag member must sign in on the login sheet. Floor-level beds can help to prevent harm from falls, particularly in patients with dementia or delirium who are at risk of falling out of bed but who cannot be given bed rails as they may attempt to climb over them. It is important that floor-level beds are used safely and appropriately. This should not be considered as a falls prevention solution and should be exclusively considered as a harm reduction tool. If you are placing a patient on a floor-level bed, please ensure that the patient's environment is free from clutter and there is no risk to the patient from entrapment in a floor-level furniture. You need to ensure that the patient cannot roll against radiators or radiator piping. Floor-level beds should not be placed close to a wall or flush with a wall due to the potential risk of entrapment. You should not use floor-level beds for patients who are mobile, as doing so can increase risk of falls. The use of floor-level beds can constitute as a deprivation of patient's liberty. Prior to placing any patient on a floor-level bed, always refer to the Trust Mental Capacity Act policy and the Deprivation of Liberty policy. The enhanced nursing care team support wards to improve patient safety and maintain the appropriate level of supervision and observation within the ward environment. The aim is to help and support patients to stay independent, maximizing their well-being and improving their health outcomes while reducing the risk and incidence of harm to themselves or others. Enhanced care is intended to be a therapeutic intervention. The Trust has introduced an enhanced nursing care team who have specialist skill and training to support this care need and are flexible and responsive to support all inpatient wards. The enhanced nursing care team rotate between patients every 3 hours, covering 4 shifts throughout the day. Staff on the ward must complete the enhanced care risk assessment for a patient who is confused, agitated, and high risk of falls that require enhanced care support. The form needs to be sent to the specialing team's email as specified on the form. Patient must also be start on a behavioral chart. Mental capacity assessment must be done to establish patient's capacity. If patient has no capacity as an outcome of the capacity assessment, best interest needs to be done. You will need to consider to do deprivation of liberty safeguards if patient is on continuous supervision and control. Other support we can explore to manage patient safety are utilizing families and carers. Families and carers knows the patient better and patient can be more compliant to familiar faces. We can use engagement activities like board games, interactive activities, music, and TVs. We can also utilize volunteers. A lot of patients are bored and no one to talk to. This is when they start getting restless, agitated, and would express to leave. Volunteers can facilitate conversations that of patients' interest and tactile stimulations like holding patient's hand where they may felt secured and assured. If an inpatient has fallen, the staff in charge of the patient needs to complete the post-fall pro forma. This care plan has guide as to what to do and actions to be taken if patient has fallen. The second page of this care plan is for doctor's assessment to complete. Staff must also complete the post-fall report sheet and send a falls prevention email as stated on the form. You have now reached the end of the training. If you need further support or for any queries relating to falls prevention, please email the falls lead as shown on this slide or contact via switchboard. Thank you.